Following hanging the saline bags, we will be opening the tubing set package. Please open this carefully as there are several components within. The components are a recirculation connector, venous tubing set with attached drain bag, and the arterial tubing set with the IV administration set attached, and the blood segment tubing. It is important to note that the arterial set is color-coded red and the venous set is color-coded blue. The arterial set is responsible for removing your blood for cleaning, while the venous set is responsible for returning your clean blood to your body. Our next step in setting up the machine will be to clamp all the red clamps on the arterial tubing set. 1, 2, 3, 4. After clamping your arterial tubing set, please locate the white spike, remove the cap, remove the saline protection seal, and insert the spike. Firmly press into the saline bag to ensure it is open. Next, we must open the blood pump door. Simply pull out towards you and the door should open. Next, we will slowly unravel the arterial blood line. There are paper tags that hold this together. Be very careful as to not introduce any contaminants while doing this. After you have unraveled your arterial tubing, please identify the thicker segment, which is the blood pump tubing. Please identify at the top is the narrower anticoagulant line and the lower saline line. Please start at the bottom and gently press the blood pump tubing into the tubing guide. Please notice that this hub should not enter the raceway. Once you have the hub in place, guide the tubing around. Once in place, use the pump handle to gently turn. You will see the guides grabbing and pulling the tubing segment into the housing. Please complete the rotation. After the rotation is complete, once again ensure the hubs are on the exterior of the blood pump housing and close the door. After inserting the blood pump tubing into the blood pump, continue with the top line, inserting into the tubing guide. Next, remove the cap from the blood line and insert into the bottom port of the dialyzer. It is nice to ensure that there is no coils in the line before twisting on. One tip is to insert into the port, do a quarter turn counterclockwise, and then begin. Doing this will ensure your lines are nice and straight after they are tightened on the dialyzer. Next, with the bottom part of the arterial tubing, please place the tubing into the right guide. Then continue downwards and place the tubing into the arterial line clamp by simply pulling the lever on the right side out and popping the tubing in. Next, please identify the arterial transducer line. This is the line that has a plastic disc filter at the end. Please unclamp this line, remove the cap, and insert into the arterial pressure transducer port. This is the red port. Again, quarter turn counterclockwise, and then continue screwing in to ensure a nice straight line. Next, take the saline administration line, ensure the roller clamp is clamped, remove cap, and spike into the second bag of saline. Please give the vessel a squeeze to ensure that you have penetrated the seal of the bag. You will know that this has properly been penetrated because after you squeeze, the chamber will fill with saline. Please note that this last line is kept clamped and unused for the rest of the procedure. This concludes the arterial side of the machine setup.